Hello friends, I am Dr. Subroto Pal, Senior Consultant Gastroenterologist and Liver Specialist. On behalf of PalMed Specialty Clinic, I invite all to our channel for our today's discussion. Today's topic of discussion, liver cirrhosis. What is liver cirrhosis? What are the causes of liver cirrhosis? How it affects our daily living, our health, and how to live with liver cirrhosis, and how to prevent liver cirrhosis in a few minutes of our talk. So stay with us. Liver is a very important organ which is situated in our body in the right side of our abdomen, about 1.5 kgs of weight. It has got multiple functions. Most important functions is digestion of food, storage of food, synthesis of some proteins, synthesis of some coagulation factors, synthesis of albumin, and also detoxification of toxins. When we ingest some food, there is some amount of toxins, some bacteria, some virus, some other unwanted materials enters in our body, and the liver is our guard. It detoxifies all these unwanted materials which are entered in our body. So these are the different important functions of liver. Liver is composed of numerous small cells, that is called hepatocytes, and all the functions of liver is actually happens inside these hepatocytes. So when these hepatocytes or the liver cells becomes injured, becomes damaged or death of this liver cell happens, so liver becomes, functions of the liver is jeopardized. So when the hepatocytes are damaged, so there is inflammation inside the liver, and this inflammation invites some fibroblast. So there is fibrosis of the liver, and the liver becomes hard and rubbery and stiff. So this is called fibrosis of liver. So when there is damage or death of the hepatocytes, there is fibrosis, there is inflammation, and simultaneously also these dead hepatocytes are replaced by some amount of newly regenerated or newly multiplied liver cells. So at the one end there is damage of the liver cells with fibrosis. On the other hand, there is regeneration of the new liver cells to replace the dead cells. So these two processes are going on simultaneously for a certain period of time, and when there is critical mass of the liver cells becomes damaged or decreased, so that point of time the function of the liver started to be declined. So this is the point where the liver becomes stiff, hard, and the structure of the liver becomes deranged. There is nodule formation, there is internal architecture of the liver becomes deranged, and this is the point where we can call the liver is cirrhotic. So cirrhosis of liver is a journey. It starts from the fatty liver and ends in the liver, loss of liver architecture with nodule formation and loss of function of the liver, that is cirrhosis of liver, and ultimate endpoint is the hepatocellular carcinoma or liver cancer. So this is a total path of the journey, and patient comes to us in different stages of the liver disease, and it is better to diagnose early with the cause of the liver damage. If we can diagnose the cause of the liver damage, then we can halt the process of these pathways, and we can actually sometimes we can revert back to the normal liver if we can eliminate the cause of the liver damage. So this is the pathogenesis, or this is the cause how the liver becomes damaged. So what will happen when the liver becomes damaged or cirrhotic? The most important thing, the digestion. There will be problem in the digestion of the food, problem in the detoxification, particularly they are more prone to develop infection because some certain amount of viruses and bacteria and fungus enters into our body with our food and with our environment, because our gastrointestinal tract is intimately connected with our environment. So when there is these germs or toxins enters in our body, the functions of the liver is to detoxify all these unwanted germs and bacteria and toxins. So if the liver is deranged or the liver function is deranged or decreased and jeopardized, so this detoxification process will not be there, so there is more prone to develop infection. Synthetic function of the liver is also decreased because of the loss of function of the liver. So there is loss of albumin, low amount of albumin, low amount of coagulation proteins are synthesized. So there is accumulation of fluid, accumulation of fluid in the abdomen, accumulation of fluid in our tissue space, because the function of albumin is to retain the fluid in the blood. When there is albumin level is low, so there is the accumulation of fluid in the abdomen and edema in the legs. Apart from this, there may be hematemesis, melena due to rupture of the esophageal varices. Sometimes jaundice can be there. So these are the different types of presentations of the liver cirrhosis. The most important presentation is accumulation of the fluid. That means the patient becomes decompensated. Cirrhosis of liver may be either in the compensated state or in the decompensated state. So in the decompensated state, the chances of reversal to normal is very less. This is called the advanced liver cirrhosis or advanced liver disease. Most of the time, this type of patients needs liver transplantation. Otherwise, it will progress further and death may occur. So, how to prevent liver cirrhosis? The prevention is by early diagnosis and elimination of the cause of the liver cell damage. What are the causes that we have already described, like diabetes, dyslipidemia, obesity, excessive intake of alcohol, infection of viruses like hepatitis B virus, hepatitis C virus infection, autoimmune liver diseases, and also some accumulation of metals like copper, iron, etc. So these are the different types of causes of the liver disease. So if we can diagnose liver disease early, and if we can diagnose the cause of liver disease in the early stage, then we can prevent the progression of the liver disease from fibrosis to cirrhosis.